going to be working on a bisected lower extremity today, and we're going to be looking at the posterior aspect of the right lower limb. We're going to begin the dissection with the gluteal region, and what you'll notice right away is that there's a very large muscle, the gluteus maximus muscle, that covers the entire gluteal region. You can see the gluteus maximus muscle here. The first step in the dissection is to remove the gluteus maximus from its attachment at the border of the lateral border of the sacrum, and we've already done that. And in doing this removal, one of the things you want to be careful of is not to cut through a very strong ligament known as the sacrotuberous ligament, which can be seen right here. The gluteus maximus muscle arises from the sacrotuberous ligament in part, so you don't want to lose that ligament because that's going to be important as a landmark later on in this unit. Underneath the gluteus maximus muscle, you can see a muscle which you should identify immediately, the piriformis muscle, which is the key to the gluteal region. You can see the piriformis muscle here as it arises from the lateral border of the sacrum and attaches at the intertrochanteric fossa of the greater trochanter of the femur. So you can see the piriformis muscle right here, a sort of pyramidal shaped muscle. The reason why the piriformis is the key to the region is because all of the structures that pass out the greater sciatic foramen from the pelvic cavity to the posterior aspect of the hip and thigh will either go above or below the piriformis muscle. You can see in this particular dissection that the large nerve, the sciatic nerve, is passing out underneath the piriformis muscle to gain access to the posterior thigh. There are a couple of arteries and nerves that will pass both above and below the piriformis muscle that you should identify at this time. They are the superior gluteal arteries and nerves and the inferior gluteal arteries and nerves, which can be seen as stubs at this point. Inferior gluteal artery and the nerve is not visible. There it is, the inferior gluteal nerve as a stub. This was supplying the gluteus maximus muscle, and so when we cut the gluteus maximus, we removed it. Coming out above the piriformis muscle would be the superior gluteal arteries and nerves, which are still supplying the gluteus medius and gluteus minimus muscles. The next step in the dissection is to reflect the gluteus medius muscle by cutting its origin off the iliac fossa. We can remove the gluteus medius muscle, and you can see some of the branches of the superior gluteal artery and nerve as they enter the gluteus medius muscle. Just deep to the gluteus medius muscle, you'll find the gluteus minimus, also arising from this iliac fossa and attaching down at the greater trochanter of the femur along with the gluteus medius. These two muscles, you'll recall, are good abductors of the hip joint. Now, we'll go below the piriformis muscle and look at a group of small muscles which you will be learning as the P-GO-GO-Q muscles. The P-GO-GO-Q muscles stand for the short lateral rotators of the hip. The first one is piriformis. Below the piriformis and underneath the sciatic nerve, you'll see the other lateral rotators, and they are known as the superior gemellus, which can be seen here, and the inferior gemellus, with a tendon lying right between them, the tendon of the obturator internus. And we can see the tendon of the obturator internus deep between these muscles. You can see it right here. Now that tendon of the obturator internus has come from a muscle belly that lies inside the pelvic cavity on the medial wall of the obturator foramen. The muscle becomes tendinous inside the pelvic cavity, and the tendon makes a sharp 90-degree bend around the lesser sciatic notch to gain access to the gluteal region, where it will run laterally to the intertrochanteric fossa. That makes that tendon, along with the two gemelli and the piriformis muscle, lateral rotators of the hip. The next muscle that you can see as a short lateral rotator is the quadratus femoris muscle, which can be seen inferior to the inferior gemellus and is visible right here, which also attaches by the greater trochanter of the femur. All of these short lateral rotators are innervated by small branches of the sacral plexus. The last short lateral rotator that cannot be seen at this point is the obturator externus muscle, and you will be able to visualize the obturator externus muscle when you perform the dissections of the joints for the lower limb. Now we've moved down to the posterior region of the thigh, where we're going to look at the group of muscles collectively known as the hamstrings. Before I do that, before you dissect out and separate out the hamstring muscles, you're going to have to remove the fascia that circumscribes the thigh. This fascia is known as the fascia lata, and there's a thickening of the fascia lata that can be seen in this dissection, and it's already been cut, known as the iliotibial band. You can see how thick the iliotibial band is, and there's actually a muscle that attaches to the iliotibial band in the anterior region of the thigh, which we'll show you later on. The four muscles of the hamstrings can be seen in the posterior thigh. Three of them attach to the ischial tuberosity, which can be seen right here. You can see that all three of these muscles attach to the ischial tuberosity. One of them is seen laterally, the long head of the biceps femoris, and two of them are seen more medially, the semitendinosus and the semimembranosus. If we look at the more medial aspect of the knee, we can see the two tendons of these muscles, the semitendinosus on top and the semimembranosus just deep to that, both of which cross the knee joint. It's important to remember that these three muscles cross both the hip joint and the knee joint, and therefore have an action on both of those joints. The fourth muscle of the hamstrings is another muscle that pairs up with the long head of the biceps femoris. It's known as the short head of the biceps femoris, and you can see this muscle as it arises from the femur and attaches with the long head crossing the knee joint. Notice that the short head of the biceps femoris does not cross the hip joint. All four of these muscles are innervated by branches of the sciatic nerve, which can be seen here as it crosses the hip joint into the posterior aspect of the thigh and runs deep to these muscles. There are two components of the sciatic nerve, one of them the tibial branch, and the other one the common peroneal nerve. The branching of these two nerves will be variable in the cadavers that you'll be dissecting, but these two components will continue down into the lower limb, into the leg. All four of the muscles of the hamstrings are innervated by branches of this sciatic nerve. Finally, the last portion of the dissection that you need to perform is to look for the arteries that are going to supply the posterior thigh. The branches of the deep femoral artery that supply the posterior thigh are known as perforating branches, and they will gain access to the posterior thigh by passing through the adductor magnus muscle. The main branch of the femoral will continue down in the anterior thigh and gain access to the posterior thigh in the popliteal region by passing through the adductor hiatus and passing down into the leg as the popliteal artery. You can see the popliteal artery right here after passing through the adductor hiatus. This is a continuation of the femoral artery. Before we look at the muscles of the anterior thigh, we're going to look at some nerves that come off the lumbar plexus and travel on the inside of the posterior abdominal wall and the inside of the brim of the pelvis. These nerves can easily be found by beginning with the 12th rib. If you palpate the 12th rib, and you should have a little piece of the 12th rib left in your bisected cadaver, the first nerve below it is known as the subcostal nerve. Then you can go down keep going down alternately until you get to the next nerve, which is going to be the iliohypogastric. Below that is the ilioinguinal, and the ilioinguinal has a nice landmark. It actually goes and penetrates the iliacus muscle near the anterior superior iliac spine, which is a good landmark for the ilioinguinal. The next nerve down is the lateral femoral cutaneous. Continuing down, right alongside the lateral border of the psoas muscle is the femoral nerve. Immediately on top of the psoas muscle is the genitofemoral nerve. And finally, on the medial side of the psoas muscle, deep in the pelvic cavity and penetrating the obturator internus muscle, is the obturator nerve. All of these nerves are muscular and cutaneous and will supply either the anterior body wall, the groin, or portions of the lower limb. To begin with the muscles of the anterior thigh, we're going to start up in the pelvic cavity and look at two muscles, the iliacus and the psoas major muscle, which both arise up in the pelvic cavity and from the lateral surfaces of the vertebra, and continue down to form a common muscle belly, the iliopsoas muscle, which attaches at the lesser trochanter of the femur. These two muscles are major hip flexors and are both innervated by the femoral nerve. Continuing down from the iliopsoas muscle, we're going to look at the muscles that form the anterior group of the adult thigh. These muscles are also innervated by the femoral nerve, so you can think of the femoral nerve as the nerve to the anterior compartment of the thigh. The most superficial muscle of this group is this very long muscle, actually the longest muscle in the body, known as the sartorius. You can see it arising from the anterior superior iliac spine and crossing the hip joint, continuing down to the medial aspect of the knee and inserting below the knee on the medial aspect of the tibia. Once you move the sartorius out of the way, you can see the other four groups of muscles of the anterior thigh, which form the quadriceps. Quadriceps is broken down into a lateral muscle, the vastus lateralis, a medial muscle, the vastus medialis, a long straight muscle on top known as the rectus femoris, and a muscle deep to the rectus femoris known as the vastus intermedius. All four of these muscles form a common tendon that attaches after surrounding the patella on the tibial tuberosity. This is known as the patellar tendon, attaching below the kneecap on the tibial tuberosity. Now we're going to move to the medial group of muscles of the thigh, known as the adductor group. This group is innervated by the obturator nerve. The first muscle that you will look at is the most medial muscle, known as the gracilis muscle. It attaches to the pubic symphysis and continues on down to pass below the knee joint and attach in concert with the sartorius and the semitendinosus muscle. During this dissection, the next part of the dissection is to take the next muscle, which is the adductor longus muscle, and bisect it and flip part of the adductor longus out of the way. This exposes the underlying adductor magnus muscle, which is this very large, massive muscle seen right here, and the adductor brevis muscle, which is a smaller muscle that attaches to the pubic symphysis. Now it's easy to tell the difference between the adductor brevis and the pectineus, which lies just above it, because the obturator nerve comes out underneath the pectineus but splits around the adductor brevis. Here you can see some branches of the obturator nerve, anterior divisions of the obturator nerve, as they cross on top of the adductor brevis. The last muscle of this group, the pectineus muscle, can be found in either a member of the anterior compartment muscles or the medial compartment muscles. This muscle is innervated by the femoral nerve and also by the obturator nerve. It also performs the functions of adduction as well as flexion. So it really can be put into either of these two groups. Now we're going to finish off the dissection by looking at the blood supply to the anterior thigh. And the main artery that courses into the thigh is the femoral artery, which is a continuation of the external iliac after it passes underneath the inguinal ligament, which would have been approximately here. As soon as the femoral artery passes across the inguinal ligament, it branches into a number of important branches. A lateral branch circumflexes the femur and is known as the lateral circumflex femoral artery. A more medial branch, which can come off of the femoral or can come off of the deep femoral artery, is the medial femoral circumflex. And these two arteries, the lateral and medial femoral circumflex, continue around to the posterior aspect of the femur and take part in an important anastomosis behind the femur and supply the head of the femur with its blood supply. The last branch of the femoral that we need to look at is the deep femoral, or profunda femoris, which we already talked about with the posterior thigh, because this artery continues down on top of the adductor magnus and gives perforating branches through the adductor magnus to supply the posterior thigh. The continuation of the femoral will follow down the adductor canal and pierce the adductor hiatus in the adductor magnus muscle to gain access to the back of the knee joint, where it changes its name to the popliteal artery.